In order to record our audit using the extended dataset as proposed by the college, you would put in an operation report, and all the data are actually entered via the operation report. Load the patient, and let's assume we've got one operation today of our test patient here. He's currently marked as a current, i.e. the operation is currently done. Once you finish with the operation, you mark him as done, and your peers will see directly that this operation is finished. You would go then to patient file, choose operation report, and choose the correct college logbook category, i.e. in this case we did a microdiscectomy. Where are we? Here, intervertebral disc. And this was a redo, so it's a rather major operation for this category, as the patient was very obese, he's suffering from diabetes mellitus, and he had previous operation at that site with severe scarring. Furthermore, he is a smoker, and these are the specific risks that are related to the surgery. The today's date is put in by default. However, if you've documented a little bit late, you can choose a different date by just clicking on the date, and you would get a calendar and you would choose the appropriate date. Put in the time that you ended the operation. Oh, there we go. And you can put in an insurance status, i.e. private, public, or work cover. And if something is missing, you can actually add that in here. Make sure that you don't add too much, otherwise this list will be rather long. Put in your location, i.e. your theater number, and the primary surgeon is pre-filled with the persons currently logged in. You could put in a secondary surgeon who helped you, and the supervising consultant, obviously. You would then specify how available this consultant was. Let's assume that he was reachable via telephone, and you would go on with the anesthetic, and usually we do this in the general tube anesthetics. You could then go on what special prophylaxis you applied, i.e. perioperative antibiotics as a single shot, some TET stockings, and sequential compression devices. With all these risks up here, the patient is probably with an ASA grade 3. Don't forget to save in between sessions when you have entered a lot of data. Please note that you do have some buttons up here, i.e. diagnosis, reuse, and add or remove editor. This editor actually applies to these buttons up here, where you can format the contents of this field. If you click on the reuse button, you would reuse data that has been previously entered in a similar named field. The same accounts for the procedure, i.e. here we've got the microdiscectomy L5S1. I will remove that. Here you could put in an indication, and you could say, okay, this patient had radicular pain in the, let's say, right leg, with paraesthesia in the S1 dermatome in this case, and then you would put in the MRI report and so forth if you like. You would then go and say conservative treatment had failed and the patient has consented in writing and so forth. We would save that, and then we would go on doing our operation report. In this case we'd do a lumbar laminotomy, and you would just change the details that are specific to this patient. So the level was L5S1 in this case, and this was on the right side, and that was again L5S1 interlaminar window and so forth. So the S1 nerve root was compressed and so forth. So if you edit your common phrases accordingly, it is very quick and easy to do your post-op operation report. You could then go on and do a treatment plan for your nurses, and again you would use your common phrases and make sure that you're happy with what you are ordering. So our lumbar spine surgery is right here, and you would save that and save your report. So here we go, and if you want to send a copy to the GP as well, you can reuse his name and address again. After that, you would go on and print out your report. This is how it would look like. And you could actually specify at which site you've done this operation, print it out, put it in the patient's file, signed, and everyone is happy. This is the first thing, but how do you get your lists? This is very easy. Once you've put on in all your operations this way I just showed you, click on patient file, click on patient file statistics, and then you can go to the RACS logbook. And here you would see a specified time frame, and by default